Abortion is healthcare. That was affirmed by this Parliament in 2019 when abortion was removed from the Crimes Act and regulated as healthcare, as it should be. It has been 5 years since the Reproductive Healthcare Reform Bill passed. It was a critical first step to ensuring safe and legal abortion is accessible across New South Wales. I'm proud of the role the Greens played in the work across party lines that was required to achieve this. But since then, not enough has changed. People who need an abortion are still impeded by cost, stigma, and geography. As a former prescriber of medical abortion, I know all too well that people are travelling hundreds of kilometres away from home and support networks, especially in the bush, or paying hundreds of dollars out of pocket for what is medically very straightforward healthcare. Every local health district notionally provides a pathway for abortion, but in many cases, this pathway is to a private provider or to a different area, which is especially unacceptable for healthcare that is so time-sensitive. Here's what should be done to fix this. Firstly, the legislation is due for an update. The TGA now allows appropriately trained nurses and midwives to prescribe medical abortions, which are permitted up to 9 weeks gestation. So does Queensland. But our legislation is unnecessarily prohibitive, and this particularly impacts people in rural and remote New South Wales. It's time to remove onerous and bureaucratic mandatory reporting requirements which don't exist in legislation for other similar medical procedures. And we must ensure that conscientious objection, which is an important provision, is only exercised as intended by individual practitioners. Conscientious objection must not be weaponised to restrict access to care by whole departments or institutions. I've commenced drafting a bill to this effect and look forward to further consultation on this work as the next step. Secondly, the New South Wales Government must provide at least first trimester surgical abortion at every public hospital in New South Wales that provides reproductive health services by tying service provision to funding. If a hospital provides birthing services and can support someone experiencing a miscarriage, it can provide abortion. This will not only address the postcode lottery, it would provide a level of privacy for people who may not feel comfortable or safe accessing a standalone reproductive health service. The New South Wales Government should support GPs to become medical abortion prescribers so that people can access comprehensive reproductive health care in the community from a professional they already know and trust. This is medically straightforward, but currently requires GPs to undertake additional training unpaid and in their free time because it's not a standard part of their training. So many people fought for safe and legal access to abortion in New South Wales for so many years, but the United States is showing us how quickly that work can be undone. The best way to safeguard our hard work is to embed abortion within mainstream public health services. Abortion is healthcare. The Greens will keep fighting until it is safe, legal and free in every corner of New South Wales.